look at Ashton and think about all the memories you have of him. Think about his Chevy truck with purple rock lights, his big personality, his 4.35 GPA, and think about the animal towel that he told you guys to create a month ago in this class. Now, let me let you in on a little secret. He's not real. There it is. That look of confusion on your guys' faces. That is schizophrenia. Now imagine this. You're in a big room with tall white walls, and you look around confused because they tell you that the majority of things you've ever known in your life are not true. That is schizophrenia. And lastly, imagine your best friend, whom you've spent most of your life with, gone in a second. That is schizophrenia. When interviewing my sister's college roommate, who was in a long-term relationship with someone with schizophrenia, she said that she knew immediately when he had not taken his medicine for an extended period of time. He became short-tempered, aggressive, and drank excessively. He claimed that Matthew wanted him to go out. Matthew was not a good person. Matthew was cruel, and Matthew was the reason that my sister almost lost her best friend. The crazy thing, however, is that Matthew was not a real person, simply a fixture in his mind. According to psychiatry.com, schizophrenia is a rare but chronic brain disorder affecting less than 1% of the United States population. Without treatment, symptoms can be deadly and very active. This most often includes hallucinations, word salad, delusions, and a hard time formulating thoughts. Research shows that schizophrenia affects everyone equally regardless of gender, race, ethnicity, and the life expectancy of patients with schizophrenia is decreased, but not specifically from the schizophrenia because of other things that go along with it, like anxiety, high blood pressure, bipolar disorder, or depression. Although extensive time and research has been dedicated to this topic, the precise causes of schizophrenia are still unknown and continue to surprise scientists as time goes on. What is known, however, is that schizophrenia is a combination of many different things. Physical, genetic, environmental, and psychological factors all combine to to increase the likelihood of developing this condition, as said by the United Kingdom National Health Service. While the cause is unknown, there has been evidence to prove that schizophrenia is in fact a brain disease. For example, mentalhealth.net says that individuals affected by this condition have 25% less volume of gray matter in their brain. In addition to this, studies have shown a low level of activation in the inferior parietal and middle frontal cortex. This shows that the brains are different in total tissue volume, but are not different structurally. There's not a significant difference. Symptoms of schizophrenia vary in each individual person affected, but there's 3 categories of symptoms that are present in every person: positive symptoms, negative symptoms, and disoriented symptoms. Positive symptoms are ones that are present and differ from the rest of society. So things like paranoia or hallucinations. Negative symptoms are ones that are absent and differ from the rest of society. So things like the lacking emotions and lacking the ability to find joy in situations. And lastly, disorganized symptoms are word salad or disorganized thoughts. As far as treatment options, unfortunately, like what causes schizophrenia, scientists do not have a for sure answer about treatment. They have many options to help decrease the effects, like medication, but do not have a way to completely eliminate them forever. Schizophrenia is one of the most misunderstood and stigmatized mental illnesses to date. Most of this can be traced back to the fact that so little is known about it. Oftentimes, again, leading to misunderstanding and miscommunication. Common stigma includes the idea that most people with schizophrenia become violent or dangerous. The thing that most people do not understand, however, is that it's not schizophrenia that makes people violent. It's often the hallucinations that bring out the worst version of a person. In addition to this, internalized stigma within patients creates feelings of being flawed and falling victim to these negative stereotypes, which creates an ongoing cycle that never stops. Although the outlook of schizophrenia is very negative, there are a few cases of people that continue to thrive in their life. One of these was showcased in Ron Howard's heartbreakingly beautiful film, A Beautiful Mind, where a famous mathematician, John Nash, learns to fight back against his second visions. Despite his schizophrenia diagnosis, he goes on to become a Nobel Prize winner in mathematics and makes a huge difference in the lives of a lot of people. Unfortunately, this is not the case for many people diagnosed with schizophrenia, and they do not have a chance to have the positive life that John Nash did. Now, obviously, Ashton is a real person, but the point of that scenario in this whole speech was to make you consider, for even just a second, what these people go through on a daily basis. It all boils down to one question. If everyone called you crazy, and your best friend, whom you spent the majority of your life with, gone in a second, that is schizophrenia.